Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Zaleplon. Its brand name is Sonata. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So, Zaleplon interacts with the gamma-aminobutyric type A benzodiazepine receptor complex, or GABA-BZ receptor complex. It binds selectively to the GABA alpha subunit in the brain. In terms of indications for use, Zaleplon is indicated to be used in the short-term treatment of insomnia. Now, before somebody was to use Zaleplon, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have experienced complex sleep behaviors after using Zaleplon, isoprolol, or zolpidem. And if a patient had a hypersensitivity to Zaleplon or any other component of the product, they would not be able to use this medication. Now, in terms of precautions, due to the rapid onset of action of this medication, the medication should only be taken once the patient is already in bed. Rapid dose decreases or rapid withdrawal of the medication can cause withdrawal symptoms. This medication is also on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. You want to avoid giving this medication to the elderly population if they're suffering from delirium, dementia, cognitive impairment, or have a history of falls. This is mainly because there may be an increased risk of experiencing worsening of delirium. It's not recommended to use this medication with other sedative hypnotics, whether that be at bedtime or in the middle of the night if the patient can't sleep. This medication must not be taken with alcohol. And the use of this medication is not recommended if a patient has severe hepatic or liver impairment. Rare cases of angioedema involving the tongue, glottis, and larynx have been reported. And complex sleep behaviors have also been reported. Some examples of these would be preparing food while asleep or making phone calls while asleep. These complex sleep behaviors can happen with or without alcohol or other CNS depressants with Zaleplon. Once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Zaleplon, they can expect to receive their dose orally. So if somebody is using this medication for the short-term treatment of insomnia, they would typically use 10 milligrams once they're in bed. The dosing range would be 5 to 20 milligrams daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Zaleplon, so I'll go over some of those here now. About 7 to 9% of patients experience dizziness, and a headache may occur between 30 and 42% of the time. Now, some more rare but serious side effects would be an anaphylactic reaction, drug withdrawal symptoms, angioedema, behavioral changes, or complex sleep disorders. That's all we're going to talk about today with Zaleplon, or Sonata. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.